Today I will be talking about genital cutting, and I'm going to be giving you the basic terms just as an introduction to the topic. The first one I'm going to talk about is circumcision. Circumcision is more commonly referred to for males. It's a very common practice all over the world, including in the US, and it's considered to be very safe, generally. Circumcision is the removal of the foreskin, and the foreskin is removed for religious reasons, family traditions, personal hygiene, or even for preventive health care. The second one I'm going to be talking about is female genital cutting, which is abbreviated FGC. FGC is often referred to as female genital mutilation, FGM. According to the WHO, FGM comprises all procedures involving partial or total removal of the female external genitalia or other injury to the female genital organs for non-medical reasons. There are four basic types of FGC, which I will be getting to in a minute. FGC is more controversial than male genital cutting because it is not just the removal of skin, but of muscle and other tissue as well, and is often used to limit female sexuality. So the first type of female genital cutting is called clitoridectomy, and it is the partial or total removal of the clitoris and or the fold of skin around it. The second type of female genital cutting is called excision. This type is where the clitoris and the labia minora are partially or totally removed. You can also include the excision of the labia majora as well. The third type is called infibulation or pharaonic circumcision, and by far it is the most severe type of female genital cutting. This is the narrowing of the vaginal opening through the creation of a covering seal. The seal is formed by cutting and sewing over the outer labia. This can happen with or without the removal of the clitoris or inner labia. Because of how small the opening is now, there includes an ongoing risk of infection from urine and menstrual fluid. The opening can also be so small that to have sex, it has to be cut open. Cutting is also needed to give birth, which is then either sewn back up again or left unsewn. So the last and fourth type of female genital cutting, it consists of all other procedures to the genitalia for non-medical purposes. This can include pricking, piercing, incising, scraping, and cauterization, among other things. According to the WHO, recent estimates indicate that 90% of cases include clitoridectomy, excision, or cases where girls' genitals are nipped, but no flesh is removed. And about 10% are infibulations, which is the third type. The last type of genital cutting I'm going to be talking about is IGM, which is intersex genital mutilation. IGM is performed on newborns when their external genitalia do not look normal enough to pass as either male or female. A corrective surgery is often followed by more surgery and a lifetime of hormonal reinforcement. In the past, doctors were more likely to try and make the child look more masculine to preserve their male privilege. However, currently, doctors are more likely to try and make the child look more feminine because they have found that there's a better and more pleasing outcome in the future. And that is it for genital cutting.